it's a 45-minute presentation. I'm going to do it in 15 minutes. So I can go through very, very, very quickly. So I won't amplify in the way that I did on the cruise ship. So the big question is, how is technology going to affect healthcare longevity and the quality of life? So I bought these pictures from the 1950s just to show you what I looked like as a child. And one of the points that I made was all of these are in black and white, because we all lived in black and white in those days. And you see the picture at Skegness with me as a little boy with my granddad and auntie and uncle. You know, the photographer who took that, he had to go and get the film developed. No digital photographs in those days. He got the film developed, and this goes in a photograph album. And in those days, the only people who ever saw that picture were people who came round to our house and were bored to death looking at a photo album. Now, it can be seen by thousands of people. And the implications of that, of creating a digital identity which will live on after you've passed away, that has, I think, some profound implications. But anyway, these are all pictures of me in different stages of my life. And of course, in the 1950s, this is pretty much what my doctor looked like. I still remember his name, Dr. Usma. And we had family doctors in those days. You had the same doctor, and he actually came round to your house when you were sick. You know, so these are the characteristics of the doctor in my childhood. And doctors were dedicated to individual families. When the tools they had in those days were really quite limited. But you had the same relationship with your doctor as you used to have with your bank manager. And all of that's changed. But the doctor's bag in the 1950s hadn't really changed in half a century. You know, doctors have been using these same tools for donkey's years. And so these devices remain unchanged for many, many years and also unconnected. But life in the 2020s is different. So again, pictures of me and the life that I live now, which is in colour, of course. And I travelled in the way I would never, ever have managed as a child. The picture there is, you probably guess, is in Thailand. So my dad died when he was 69. And my life and my health is infinitely better than my father's was. And when he died, he was an old man. He was an old man at 69. He was an old man when he was 60. And I like to think that I'm not. Now, doctors look very different today. They're smartly dressed. They have laptops. But you don't see the same doctor all the time. You see a pool of doctors. And they tend to be a bit more focused on prevention than they were in those days, in the early days. So you like to have a different doctor every time. The doctor's bag looks pretty much, it's a more modern bag, but what's inside it is not that much different, except you've got a smartphone and devices now are connected and data is stored over a longer period. So the impact of digital technologies on the doctor's bag, you've got greater accuracy, of course, from these technologies, and the doctors have got more decision support tools. So what's new? Today, we've got the challenges of the ageing society, which is what we're talking about in this session. We're talking about the impact of digital technologies on healthcare, about personal health management, about healthcare. I wanted to talk about on the cruise ship about how I lost 21 kilos in 3 months. And that was when I first discovered lifestyle medicine. And there's a video at the end. I did a bit of a skit on Black Lives Matter and call it Old Lives Matter, to show some of the prejudices that exist about older people and some of the misconceptions. A little video. Well, this is my mum. This was my mum when she was in hospital. She died of dementia. So she went through what I now know to be the Liverpool pathway. Only the trouble was she wasn't dying when the nurse came and told me she was dying. She wasn't dying. She said, the nurse told me in Kettering A&E. She said, your mum's exhibiting chain stoking, which is a form of breathing which people have when they're near to the end. And I thought to myself, my mum's snoring. I know my mum's snoring. So, anyway, the nurse said we'll take her up to the top ward, and you can, be with her. So I was with her, and she was still breathing, and eventually I had to go home. Came back following morning, went into a room, and she opened her eyes and looked at me and smiled. And shortly afterwards, the doctor came in, and he again repeated what the nurse had said. You realise your mum is very seriously ill. We're not giving her any medication. We're not hydrating her. And I said, she just opened her eyes. He could have knocked him over with a feather. He looked absolutely gassed, and so he said, Mrs. Wortley, can you hear me? If you can hear me, raise your arm. Arm went straight up. So they put her back on hydration, and the net result was that she was able to be discharged, and she went into a care home, and she lived another 3 or 4 months after that. But it gave me a good idea of some of the challenges of the aging society, because my mum was very typical of what is happening in households all around the world. So we're living longer, we need more medical care, we all know about that, but there are fewer people working to be able to cover the costs. And the caring for the elderly is a shift from how it used to be, people were looked after in the home, into care homes. And today, I believe elderly care is a poor relation of public health services. Because when my mum first went into independent living, the quality of care, this I'm talking about 15, 16 years ago, she had her own apartment, and there weren't qualified medical people there, but social services looked after her. And I argue that she had a quality of care which was too good, because she never had to do anything for herself. People came in to do a washing, different things. And so because of that, my mum just sat watching television, getting fatter and fatter, waiting for me to come and see her. So that's not really good for people. And it's gone too far the other way. And coronavirus really has exposed our vulnerability to the unsustainability of public healthcare services. So longer life, and Neil is doing something about it now. Longer life means bigger healthcare costs and more time in poor health. And this is what longevity is trying to address. So you have more time in good health. So this is a little chart basically to show this imbalance, is that the number of the burden of cost as you get older is disproportionate, and it causes a strain. And digital technologies, whilst having a positive effect, they can also have a negative effect. People are getting obese because they're just sat in the chair being entertained and stuffing themselves with fast food. And young girls are following their social influencers with their body image. And as a result, they're becoming extremely depressed. So digital technologies not only have positive benefits, but they also amplify the temptations and the stresses that affect your health. This is an interesting website, if you ever get on. So it's called the Death Meter. It shows you almost in real time how many people are dying at that moment and what they're dying of.
Oh, lovely.
And it's great. It's great entertainment.
So we look at when you can't sleep.
But the point about this is to show that people are not dying of infectious diseases these days, even with COVID. The majority of people were not dying from infectious diseases. They were dying from non-communicable diseases, which are lifestyle related and largely preventable. So that is what people are dying of today. And 70% of all deaths are from these lifestyle related non-communicable diseases. So how can we address these solutions? Well, I put them into two categories: preventative healthcare and improving the productivity and performance of staff. On the prevention side, we've got drugs, we've got the healthy exercise, longevity strategy, and we've got technologies that improve the productivity of staff. The problem is that the temptation is there. You know, drugs are an easy fix, and I think all too often the medical professionals go for that because it saves them time. You know, give them some drug. My partner's just gone onto statins, and it's affected her health already, and so we need to be more conscious of comorbidity and the real problems behind people's death. So the role of drugs is an easy option for both doctor and patients. Not just doctors, patients want the quick fix as well. So this is a picture of taken of somebody having the injection for anti-obesity. You know, so it's designed to stop you eating so much and not get. And of course, for people who are overweight, you know, the idea that you can carry on eating or have a little injection that will stop you is really quite tempting, but it's not really a solution. This is my partner's father. He lived with us for the last year of his life, called Eric, and that was his drug regime on the left-hand side of the table. That's what my partner had to make sure he was administered with. I mean, fortunately, Eric didn't suffer from dementia. His brain was quite active, but he had many other medical problems, which led to him living with us, so he could be cared for. When it came to the end of life regime, you can see the number of drugs was drastically reduced. So what we're trying to do today is make this transition from cure to prevention, and behavioural changes in our lifestyles are critical to that. And this is a quote from Sir Simon Stevens when he became the head of the NHS. He said, "We've got to do something about increasing our lifespans and quality of life, and the only way we can do it is to adjust our personal behaviours and to do so at an early age." So how can technology solve the problem? Not just at the individual level, but also at a group level. Well, as we've heard from Fraser this morning, that there are very important health and well-being influences that we can do something about: diet, exercise, hydration, sleep, mindfulness and stress management, and the importance of social support. So these are the 6 pillars of lifestyle medicine. And the role that consumer digital technology, and I use the word consumer, I stress the word consumer because this is where we are going. I know I'm a geek, and I've tried pretty much most of the wearable devices that, you know, come onto the market. I got 2 at the moment. There's my watch, and there's my ring. And I'm very excited about this because it measures a lot of important vital signs, and the battery life is about 10 days. So I don't have to worry about it. And I've got a very good dashboard. And the thing about these technologies as they are today, and I know people in the medical profession rightly are worried about the accuracy of these devices, but my view is that they measure changes. That's the important thing, is if you see changes in your vital signs, it doesn't necessarily be 100% accurate, but it's the changes over a period when you can track the history of the changes that's absolutely vital and important. So these devices, they not only measure the key influences, they can allow you to set your own benchmarks and set achievable goals. So I started in 2013. My goal was to walk 10,000 steps every day. That was how I started. But you also have to have a supporting environment to encourage and help you. And this is where the group consultations that Fraser mentioned are so important. And it's all about trying to encourage personal responsibility and giving people the tools to be able to do that. So these are a range of technologies today that I think are great enablers. And my background, I founded the Serious Games Institute. Gamification is one of the areas of my expertise, and it was gamification really that led me to explore whether I could gamify my own health. And I found out that you could, and we've seen from several examples today that a lot of people are already using gamification not only for themselves but also designing it into the kinds of products and services that are available. So we've got exercise technologies. These are some of the types of wearable devices. The device I use is in the top right, and that's what I started with, the jawbone or jawbone up. And now, of course, we have these kinds of rings with associated mobile apps, and these are dashboards of some of the devices that I've used over the years. So with the jawbone up, which I still think was a great device because it measured my sleep, it measured my physical activity, and it rated what I ate. And these are two other devices that I've used over the period. But there are demonstrable results. So this is what I looked like back in 1998, 26 years ago. I don't believe I'm that old. But that's what I look like in my hobby is acting. And this was a screenshot from one of the plays that I was in. In 2011, I've not got much better. I've still got my podge. This is me presenting in Kuala Lumpur in 2011. And in 2013, this is what I look again on the stage. And this was one of the things that prompted me to do something about it. Not because I looked at that picture, I thought, oh God, do I look like that? It was because friends had come to see me in this play, and one of them said, Dave, where did you get your stomach padding from? And I wasn't very And another friend said, you're getting fat. You know, you need friends like this all the time. So it went over like a water off a duck's back at the time. But I then met a friend in London for a coffee, and she said, you should get your DNA tested because I think you've got Russian blood in you. You look like a Russian bear. Because I got the thick neck, I was bulky, and she said, go to 23andme.com and just send them a sample and you'll see your genetic origins. So I thought that would be interesting. So I sent this off. No, I don't have Russian blood, but I did find that half of my family comes from an area in the North Sea now, Doggerland, and the other half was from the Basque region. Very little anywhere else in the world. But the interesting thing was it also told me that my likelihood of getting diabetes, and it told me I got a 50% chance of getting diabetes too. And that really made me think. And so I decided to do something about it. So I got, and then the final piece of the jigsaw was I was lying in bed one Saturday morning, nothing much better to do, looking at my phone, and there was on the BBC website, there was an article about 10,000 steps and this device called the Jawbone Up. So I put all of these things together and decided to gamify my health. So I'm going to start walking 5 miles, 10,000 steps every day. So I started, and within 3 months, it's a transformation. You know, quite remarkable. And so ever since then, I walk 5 miles every day, and I still do. I've missed very few days. The only time I ever like to miss it is if I go on long haul flights. And even then, I walk up and down the plane or in the airport terminal. I'm still doing that. But I did learn that it's not just exercise; it's about many of them.
How much time do you allow for your 5 miles?
Well, it takes me. Normally it takes me about an hour to do 5 miles, about an hour and a quarter. It's a quarter of a mile. I do a mile in about 15 minutes. And I've started doing webinars when COVID came along, and I got people to come and talk to me, and I made this little video about healthy aging tips with a guy from the USA who is a specialist in health psychology, and he does pretty much the same as me. I'm not going to play this because there's not enough time to do that, but this gives you an idea of what the video looks like. But here, Neil, thanks to Neil, here we are, longevity app. This is quite a while ago. I'd only earned 595 activity points at that point. And my bio age was 69 years. My strength age was 55 years. My cardio age was 67. And you see how it's broken down. I haven't shown you the other two things because my metabolic age was 71, but I'm ashamed to say that my flexibility age was 85. I wasn't surprised at that because I've never been that flexible, and I think the tests that you give me are a bit well, a bit flaky. So now I have a bio age now of something like 65.
And that's not flaky.
So that's not flaky. And these are some of the dashboards that I've got from my ring, JC ring. You can see some of the status there, and the other one is this watch that I wear that measure my vital signs. I'm not so interested in the absolute figures, it's the trend that's most interesting. Of course, diet technologies as well. There's lots of diet and nutrition apps. I did have a Fitbit, which stopped working when Google took them over for some strange reason, but they did also incorporate recipes. And then there's epigenetics, and again, longevity work with a company called Moodoo, who developed technology, again, taking a DNA sample, and Moodoo was designed for elite athletes. I don't put myself in that category, surprisingly, but it was designed for elite athletes to give them advice based on their DNA, what the best exercise and best diets work for them. And so that will work for everybody. But today I'm using Zoe. Zoe is my new girlfriend. Zoe is the app which comes in a box which measures your blood sugar levels. You take a blood sample, you take a stool sample. So it tells you what your gut health is, what your blood sugar health is, and what your blood health is. And it gives you a gamified environment that ranks every meal that you eat. And I've discovered, and my diet has changed quite dramatically, so that has some influence on the reason why I've lost weight. It's not just all down to Neil and his gym, it's to do with Zoe as well. But I discovered from my eating habits that I'm all right. I'm pretty good. I have very good scores on my diet until it gets to dinner time. And that's when it goes pear-shaped. And so I blame my partner for this because she buys food for dinner. And one good example was she bought Charlie Bigham's salmon en croûte, which sounds really great and it's look very, very tasty, but actually on the Zoe score, you get nearly 0. So I suddenly find myself, with bad ratings for unhealthy fats and a lot of processed food. But Zoe is a good example of the way where things are going. So this is where we're going as far as diet and nutrition are concerned, and personalised diet and nutrition based on epigenetics, but also some influence of medication and AI machine learning. But increasingly, and we are seeing this with a lot of food services that deliver either fresh food that you cook yourself with a recipe, or things like food service which will deliver healthy meals to your door. So I can see these things starting to come together. So you are actually supplied with the things that will be good for you, and feedback, neurofeedback we've seen from trade, but also feedback from the biometric data collected from wearables. Hydration technologies, there are devices that give you a water bottle and they nudge you when it's time to have a glass of water. And it is very important to have 8 glasses of water a day. That's another one of my disciplines. I don't have any apps that nudge me, but one thing I found very effective is I have a pint glass on the kitchen sink. So whenever I come in and have breakfast, or when I come in and have a coffee break, I see the glass there and it prompts me to fill the glass with water and drink it. So I have a healthy habit, but I need that prompt to remind me that it's time to drink some water. Sleep technologies. Again, this was something that I learned quite early on, and that was from the Jawbone Up. Gave me some links to websites that explain how to help with your eating patterns. One example is leave at least 3 hours after dinner before you go to sleep. So don't have a late meal. That's going to help you. Make sure you're well hydrated. Hydration is also very important for sleep. Then the stress management technologies, there's a variety of tools and apps to support that. And then you've got social support technologies. And in today's atomic families where kids move away from home, it's very important to be able to make those connections. This is an example of a screenshot from Portal, where you get as far as you can do it, the impression that the people are at least close to you or in the same room with you. So when it comes to healthy active aging, these are the messages that I've learned myself. It's about creating new behavioural habits, so it becomes more of a routine. But the technologies, particularly for older people, they must be plug and play. And gamification is very important. So it's important to challenging is very important component of gamification. You don't learn anything without having a challenge that you fulfill. But if you incorporate that with a bit of fun through a game, that will help. Connecting and engaging with family and community, we've seen in rehabilitation the importance of the family in all of that. And it's a bit about providing feedback and diagnostics, both for motivation and health tracking, and giving people more control over their own health. So these are the steps that I think are important in changing your lifestyle. And now, partly because I've gone into AI and digital twins and deep fake and all that kind of thing, I can see in the future you will have your own digital coach, which will be an avatar. And it could be an avatar of yourself, giving you advice on your own health, taking the data that comes from the wearables and everything else, and having a little chat with you in the morning or determined times to give you an additional level of support. So this is one of my digital health avatars. So in conclusion, lifestyle medicine is key to preventive healthcare. Behavior change is very complex, and it depends on your personality and socio-economic circumstances. And digital technologies do have a role to play because they what you can't measure, you can't influence. But if you can measure something, you've got a chance of influencing it. And these are becoming more and more affordable. And these technologies don't exist in isolation. They're all part of a health and well-being digital ecosystem. And this can facilitate win-win collaboration between health stakeholders. So the message is the power is in your hands. The tools are there, they're available today, and we should make more use of them. Maybe I will just show you a little clip of this, just to give you a bit of a laugh, but This is my Old Lives Matter video. This is exercising my thespian tendencies. Where's the sound one? Anyway, yeah, so you can see the point about it is that when you look at me, you get an impression. Some of you know me already, so you've already formed that impression a long time ago. People don't know me, will look at me, and if somebody watching this video would think I'm talking to an imaginary person, and because of what I'm saying, I've got hearing difficulties, and so, or I've got failing eyesight. And I made this video to make the point that old lives do matter, and older people have got a great potential in shaping the future of the world we live in.